All right, folks, in this video, we're going to be going over original Medicare, what is original Medicare, and the two main options you have to utilize your Medicare, okay? We're not going to get into the third option today, which is an MSA or a Medicare savings account. And that's a little more complicated. There is a video on this website about that. But today, we're going to discuss original Medicare. We're going to discuss Medicare supplements or Medigap. And then we're going to go over Medicare Advantage. We're going to compare the two, okay? Medicare, original Medicare, Part A and Part B, that red, white, and blue card. Part A, there is no premium for Part A as long as you've worked more than about 40 quarters, which is 10 years. If you've worked for 10 years, you don't have to pay a premium for Part A. It's free. Okay, so no premium. On Part A, this is for hospital coverage, so your hospital room and board. You get admitted to the hospital, there is a $1,500 and $56 deductible, so $1,556 deductible. And that is every quarter. So it's not just a one-time, once a year deductible for your Part A. And if you have an extended hospital stay, you can really start to pick up some hefty hospital bills down the road if you have an extended stay at the hospital. Okay? So there's a gap that original Medicare doesn't cover. Part B. This is 2022, and so we're going numbers off of that. If you see this video in the future, numbers could be different. But the Part B premium, for most people, not everybody, but it's $170.10. $170. It is based off of IRMA, it's based off your income. So most people are paying that $170. However, if you are making a substantial amount of money, that premium could be higher for you. But most people, we find, they do fall in that $170 Part B premium range, okay? You have to pay this Part B premium to have original Medicare. Regardless of what option you go with, if you go with Advantage, if you go with Supplement, you have to pay that Part B premium, okay? Part B, there is a $233 one-time annual deductible, right? And your Part B is medical procedures, surgeries, doctor visits, labs, x-rays, outpatient services, things of that nature, things that are not in the hospital. That is your Part B. You have a $233 annual deductible. For most people, you have a $170 Part B premium. That premium last year in 2021 was $148. Next year, we anticipate that number, that Part B premium, being anywhere from $190 to $200. We'll see what Uncle Sam does with that. Part B, after you hit that $233 deductible, they're going to cover, Medicare is going to cover 80%. That means you pay the leftover remaining 20%. The big problem with that is there is no cap, meaning there's no max out of pocket. So if you have $100,000 in medical bills, you're paying $20,000, okay? Theoretically, if you had $1 million of medical bills, you'd pay $200,000. It is uncapped. Original Medicare was never designed, it was never meant to be your sole form of health insurance in retirement, okay? That's basically original Medicare summed up, okay? One more thing is you have the right on original Medicare to see any doctor or provider that accepts it. Right now, it's on average around America, it's about 98% of providers take original Medicare. Here in Kansas City, I think this number is even higher. I think it's closer to 99%. And you don't need a referral to see a specialist from your primary care physician, and you do not need a prior authorization. So you call the shots. You go where you want to go, and you see who you want to see. Okay. Where we can go from here is you can keep your original Medicare. You can keep your right to see any doctor or provider that takes it. And you can supplement your original Medicare with a Medicare supplement, or also called a Medigap policy. Fills in the gaps of original Medicare, it supplements your original Medicare. Now there's three main plans. The three most popular plans are Plan F, Plan G, Plan N. If your Medicare effective dates are after January 1st of 2020, you can no longer get a Plan F if you're going on to Medicare. It's continued. A Plan G is essentially the same thing as a Plan F. Very similar. Now, what does a Plan G cover? Well, a Plan G, Medicare Supplement Plan G, it's going to get rid of your Part A deductible, quarterly deductible of $1,556. That's gone. It's going to cover the 20% coinsurance for Part B services. That's gone. The only thing a Plan G does not pay is the $233 Part B annual deductible, okay? So on a Plan G, you pay the first $233 for Part B, and then everything after that is 100% covered. Okay? So if you had $100,000 in medical bills and you had a supplement Plan G, all you're going to pay out of pocket for A and B services is $233. Okay? Plan G is currently the most comprehensive Medicare supplement plan that you can get. Okay? We call it the SWAN plan, the Sleep Well at Night plan. Now, Plan N is very similar. You got to still pay that first $233 of the Part B, and then everything after that, you're going to see some smaller copays. Small copays. We're talking $20 copay for your primary care, $20 copay for a specialist, $50 copay for the ER, and some other real small copays after that. But you can save money in premium on a Plan N. Plan N also doesn't cover Part B excess charges. What that is what Medicare says providers can charge on top of what Medicare approves. It's up to 15%. So if you have $100 for whatever you get done for Part B, they can charge $115, right? So you're going to see a $20 copay plus another $15 there. Really just depends on, do you want to save some money on a Plan N, or do you just want to get a Plan G, pay the first $233, and then not have to worry about it after that, okay? And again, on both of these, you keep your right to see any doctor or provider in the country without a referral or prior authorization, okay? So you got to pay to play here with these supplement policies. For a Plan G, around here on average, what we're seeing, these plans are going to increase every year. We can help you figure out or decide, hey, these companies have a good history of rising rate increases each year, and these companies tend to jack the rates up on you very, very steep. Okay, so Plan G, we're on average around here, we're seeing it's about $170. for a Plan G. And that's on top of that $170 that you got to pay for your Part B. For a Plan N, we're seeing about $120. Now, some Plan Gs we can get you at $150. Some Plan Gs we can get you at we'll get you at $190. We'll get you the cheapest rate in your area as long as it is an A-rated carrier. So give or take, $40 to $50 each on both of these numbers. But ballpark, $170 for a Plan G, $120 for a Plan N. Okay. Now, you also have to add Part D. That's your drug coverage. It's not included with this option. Your average standalone drug plan, for most folks, it's right about $20 a month. Some people it's $13. Some people it's $50. What it's based off of, we'll quote you out, is based on the prescription medications that you're taking. What plan covers your medications the best? Okay, we're not necessarily trying to get you the cheapest drug plan. We're trying to get you the drug plan to where if you combine your annual premium with your annual drug copays, what number is the lowest, right? So bottom line, at the end of the year, we're trying to keep the most amount of money in your pocket, regardless of what that plan premium is, okay? But on average, most folks, we see Part D drug plan costs about $20. None of this includes dental, vision, and hearing. So you can also add a dental, vision, and hearing policy, about $30, depending on how much coverage you want. Okay. Now, if you get hit in the eye with a baseball and you go to the doctor and they're not gonna tell you, oh, you don't have eye coverage or vision coverage. No, that's medically necessary. We're talking about eye exams, glasses, dental cleaning, stuff like that is not technically medically necessary. It's not approved by Medicare. Medicare or a Medicare supplement doesn't cover that stuff. You got to get additional dental, vision, hearing policy, okay? So all in all, if we add that up, we're looking at your Part B premium of $170.10 plus, we'll split the difference here. We'll say $150, depending on what plan you go with. $150 plus $20 for Part D drug coverage. We're looking at $340 all in without dental, vision, hearing. We're looking at $370 with dental, vision, and hearing. Okay, so we're looking at about $350 all in if you go with this option. Again, you can continue to see any doctor, any provider in the country that you want to see without referrals or prior authorizations. You do not have to participate in a plan network with this option. Okay. Now let's go over to the other side. Let's talk about Medicare Advantage. Okay. What Medicare Advantage is, it's been around since 2006, and it's become more and increasingly popular over the years. These plans are getting more competitive each and every year. So you have to pay that $170 for your Part B for original Medicare, regardless of which option you go with. What Medicare Advantage is Medicare is going to give that $170 that you pay for original Medicare, and they're going to send it to these private insurance companies offering Medicare Advantage plans. We represent all of them, but just to name a few, for example, United Healthcare. It's one of our favorite carriers. Humana, Blue Cross, Blue Shield, whatever. I could keep going on. But Medicare is going to send that money to these private insurance companies, and they're going to facilitate a Medicare health insurance plan for you instead of original Medicare. Now, what's good about these Advantage plans is they have max out of pockets. On average, in our area, we're seeing anywhere from $3,000 to $8,000. So there is a stop loss for your Part B. The most amount of money you're going to pay on some of these plans, some of them are as low as $3,000. Whereas if you just had original Medicare, if you have $100,000 in medical bills, you're out $20,000. These Advantage plans have max out of pockets. Okay. You're going to see some co-pays along the way. You're going to see $0 copay to see your primary care doctor. You're going to see anywhere from a $25 to a $40 copay to see a specialist. You're going to have some copays for labs, blood work, x-rays, MRIs, $90 copays, $125 copays, stuff like that. Now, the biggest gap in these Advantage plans is your hospital coverage. You get admitted to the hospital, you have anywhere from a $250 to $350 daily copay. Days 4 through 6, either 4. So I mean days 1 through 4 or 1 through 5 or 1 through 6, depending on the plan. So you could be out on some of these plans anywhere from, $1,700 to $2,500. You could see that bill if you go to the hospital. With a Medicare supplement, a Medigap policy, you're never going to see that. Now, what we can do is we can add a hospital indemnity plan onto your Advantage plan. HIP, hospital indemnity plan, anywhere from $30 to $60 a month. That will cancel this Part A that your Advantage plan doesn't cover. Okay, so it'll get rid of that if you want to add a hospital indemnity plan to it. But then again, you're closing the gap of how much money you're saving between a supplement and an Advantage plan. Now you're not saving as much money, right? These Advantage plans include Part D drug coverage. It's one of the biggest things, most important things we look at in Advantage plans is how do they cover your Part D? How do they cover the prescription medications that you're taking? And the formularies are all different on these plans, okay? They also include things like dental, vision, hearing, over-the-counter benefits. Even they can put some money back in your Part B premium. They can give you money back in your Social Security check. Those are those Joe Namath commercials you see. Now, be careful. They're just wanting you to call in, and they're trying to flip you on whatever they can flip you. Number one thing we look at in an Advantage plan, hey, are your doctors in the network? Okay, we want you to be able to go see the current doctors you have. If it's a PPO plan and you go out of network, those copays are going to be much, much higher. Are your doctors in network? Are your prescription medications covered well? And are your preferred hospitals in the network of the plan? Now, these Advantage plans, like I said, they're getting better and better. We have a carrier here in Kansas City that has every single hospital in network except Children's Mercy. So they're getting better each year. They're getting more and more competitive. Question is, are you willing to pay this extra premium to be able to go anywhere you want and to not worry about medical bills as much? Or would you rather just pay that $170 for the Advantage and hope nothing happens? Advantage plans can work for you, but it's really important that you consult with somebody who represents all of the plans, represents all the carriers. They're not loyal or biased to any particular insurance company or insurance plan. That's what we do. We want to shop out all the plans and compare all your options for you to make sure that you're in the right Advantage plan for you. Okay? Hope this has been helpful. If this has been helpful, please go to our homepage, give us a Google review, or reach out to us, and we'd love to help you out in any way we can. This is Medicare Simplified, and here it is all about education.